Hey everyone, it's Nurse Sarah, and in this video I'm going to do a quick review over the different types of insulin. So let's get started. When you're studying the different types of insulin, there are some huge things that you want to remember for exams. First up, you want to remember the specific names of the medications that fall into each type of insulin. Also, you want to remember the onset, peak, duration of those insulin type groups. Now, what is onset, peak, and duration? Well, onset is when that insulin actually starts working. The peak is when that insulin is working at its strongest. So if insulin's working at its strongest, it's really uptaking some glucose. And this is the time when we can actually drop that glucose level. So there's a risk of hypoglycemia during this time. And then duration is how long that insulin keeps working. So first up is the ultra rapid acting insulin types. And this type of insulin is somewhat new to the group, and it includes a faster acting aspart and an ultra rapid acting lispro. Now, whenever we talk about another group of insulin, you're going to see that it includes aspart and lispro, but these are different for this type because they have been modified. They've added absorption boosters to them to help speed up onset, so when that insulin starts working. For example, with aspart, they have added a substance known as nicotinamide, which is a form of vitamin B3, and this is going to help speed up its absorption. Now, what you want to know about this group is its onset, peak, and duration. So we're talking about ultra rapid. That means it's going to be pretty fast. So it's going to have an onset of around 5 minutes. It's going to have a peak of around 1 hour and then a duration of around 3 hours. So how can you remember all that information? Well, remember this mnemonic I created. It's a phrase. Okay, so remember this. Sugar running free, ultra rapid works in 513. So we have in that phrase the type of insulin we're dealing with. And then we have the onset, peak, and duration, which is with the 5, 1, and 3. Then next we have the rapid acting types, and this includes lispro and aspart, but here they haven't been modified like how they were in ultra rapid and glulazine. They have an onset of around 15 minutes, a peak of around 1 hour, and a duration of around 3 hours. So whenever you're trying to remember this information, whenever you look at the peak and the duration, they're roughly similar to the ultra rapid, but this can really vary depending on the patient's metabolism, their absorption rate, the dose you gave, and even where you gave the injection. But the big thing, what makes them different, is that onset time. With ultra rapid, that onset is faster than rapid, which is just a little bit behind. So hopefully that'll help you remember that for the exams. But a mnemonic you can remember is, remember this: 15 minutes feels like 1 hour during 3 rapid responses. 15 tells us the onset, the 1 hour tells us the peak, the 3 tells us the duration, and then rapid tells us what type of insulin we're dealing with. Next is short-acting insulin, and this includes regular insulin. It has an onset of around 30 minutes, a peak of 2 hours, and a duration of around 8 hours. And how you remember this is, remember this phrase: short-staffed nurses went from 30 patients to 8 patients. The short tells you we're talking about short-acting. The 30 tells you it's onset. The 2, the TO, which you can remember with the number 2, tells you the peak, and then the 8, that part tells you the duration. Next is intermediate, and this includes NPH. Now, it has an onset of around 2 hours with a peak of 8 and a duration of 16. So how you can remember that is, remember this phrase: nurses play hero to 8 16-year-olds. Nurses play hero represents NPH, which we're dealing with an intermediate acting insulin. 2 represents the onset, 8 is your peak, and 16 is your duration. Now, before we go into our last type, I want to back up for a moment and point out some important things to you about the short and intermediate acting insulin. So with short, we talked about regular insulin. So with regular insulin, what I want you to walk away with is that it's one of the only insulin types that have been approved to give IV. Now, let's say that you have a test question that asks you how you're going to mix insulin. They tell you have regular insulin, which is our short acting, and you have some NPH, which is our intermediate. How would you mix it? Like, they may ask you, which one are you going to mix last? Which one are you going to mix first? Or they may tell you to tell the process. How you can remember that is that remember either 2 things. You can remember RN for registered nurse, that you're going to mix the regular first and then the NPH, the intermediate. So RN, that tells you the order. Or remember clear to cloudy. Regular insulin is going to be clear, so it will be clear first, and then the cloudy will be your NPH or intermediate, and you will mix that, so clear to cloudy. So remember those things for tests. And then lastly, we have the long-acting types, and this includes medications like glargine, Detromere, and degludec. Now with these, their onset tends to be around 2 hours. They don't have a peak, or it's very, very minimal, and their duration is around 24 hours. Now, two things I want to point out about this is that, notice that duration, it's the longest of all the 3 types we talked about, hence why they're called long-acting, and they don't have a peak like the other ones did. Now, to help you remember that information, remember the phrase, the 2 long nursing shifts never peaked, but lasted for 24 hours. So 2 represents the onset, long tells you what category we're talking about, never peak tells you they don't have a peak, and then 24 hours is your duration. Okay, so that wraps up this quick review. If you'd like to watch more videos on pharmacology, you can access the link in the description below.